Good morning. This is Amy Rowley McGee. I'm the president of the Health Policy Institute of Ohio, and I'm joined here this morning by Director Lance Heim from the Ohio Department of Health, and as well as several other staff from ODH and from HPIO. To get us started here this morning, I just want to go over some housekeeping details. Okay. First, want to mention that the slides and a recording of today's webinar will be posted on the HPIO website after today's session. Please use the chat box to ask any questions throughout the webinar. HPIO is very pleased to be partnering with the Department of Health on the next state health assessment and the next state health improvement plan. We're also very pleased that the response to the invitation to serve on this advisory committee has been very strong. The timing of this particular SHA and SHIP presents a unique opportunity for us to inform the next administration's priorities related to health, as well as the priorities of the next General Assembly as well. The role of this advisory committee is to provide guidance to ODH and HPIO as ODH's contractor on the content of the state health assessment and the format. Also to inform the priorities, outcomes, and strategies that will be incorporated in the next state health improvement plan, and to advise on dissemination and outreach. As I mentioned, the response to the invitation to serve on this advisory committee has been quite strong. We have well over 80 people who have committed to serving, representing a wide variety of sectors. We'd like to kick off today's webinar meeting by asking our first poll question, which is, did you participate in the previous state health assessment or state health improvement plan advisory committee? So a simple yes/no question. If you could please take a moment to respond. We'll hold here for a minute or so while everyone has a chance to log their responses. All right. So it looks like slightly half so far have said they were not involved in the state health assessment, state health improvement plan advisory committee. We'll give another few seconds for additional responses. Okay. All right. Now let's move along to the agenda for today's meeting. Today we're going to start by reviewing the SHA SHIP timeline and the various components of these assessments and plans. We're going to talk about the purpose and the process. We're also going to share some data from the SHA regional forums that we hosted with ODH in October and the online survey that was put out shortly after that. We'll share what that process was like and what the findings are from those. And then we'll have some time for question and answers, and then talk about next steps and, of course, evaluation of this particular meeting. The objectives of today's meeting is to make sure that everyone who's serving on the advisory committee is aware of the project timeline, that we all understand the purpose of the SHA and SHIP and alignment with the MCH and McV assessments that will be happening in tandem. That we'll all know where to go to find information about the SHA and the SHIP, both the previous SHA and SHIP, and then also information about the one that we will be working on going forward. And also that everyone on the advisory group is familiar or knowledgeable about the findings from the SHA regional forums and the online survey. All right, I will now hand off the webinar to Director Lance Himes, who will talk about the timeline and the various components.
Thank you, Amy. Really appreciate the introduction and the opportunity to be here today. On behalf of the Ohio Department of Health, I want to thank everyone who is on the webinar for serving on this committee. I'm glad to see we have so many new participants, as we saw in that first poll question. I think it's going to add some new angles to what we've done before, and really appreciate your participation. So the efforts of this committee are critical to improving the health of all Ohioans. Last week, the United Health Foundation released its annual America's Health Rankings report. And for nearly 3 decades, the America's Health Rankings has provided analysis of national health on a state-by-state basis. And they look at the historical and comprehensive set of health, environmental, and socioeconomic data. Ohio's rank was 40th in this latest report. We dropped 1 spot from 39th on the previous report. Unfortunately, we've steadily dropped since 1990 when they started, and we were ranked 27th. However, we must and we will reverse this trend, and this process is one component of reversing that trend. And we know this won't happen overnight. It will take some time and persistent focus and commitment, and that's why we appreciate your participation and guidance, and certainly some alignment, aligning around shared health priorities and goals. This committee is a part of the process of conducting a state health assessment. We'll then use that assessment to inform our state health improvement plan, which represents an aligned and comprehensive approach critical to improving population health in Ohio. Our vision, and this is the same vision we had in our previous process, is that Ohio will be a model of health and economic vitality. And our mission is to improve the health of Ohioans by implementing a strategic set of evidence-based population health activities at a scale needed to measurably improve population health outcomes and achieve health equity. And health equity is very important in that mission. I want to stress that. So as you know, and we'll talk about this a little bit later today, we did conduct a state health assessment in 2016. We used those results to develop our 2017 to 2019 state health improvement plan. Now this process is part of our 2019 state health assessment, and our goal is to complete that by June 1st. And we'll use that to inform an updated 2020 to 2022 state health improvement plan. And our target for completion of that is October 1st, 2019. And the slide that's up on the screen currently is our past process, where we are currently in 2019, and then in 2020 to 2022, partners, local health departments, and tax-exempt hospitals would align with their CHIPs and their implementation strategies. The timeline for this specific process, as many of you know, we had state health assessment regional forums this fall, and many of the key findings will be summarized later this morning by HPIO. We did see very good numbers of interested stakeholders and partners turning out and participating in those forums. There are 5 held across the state. There are also additional surveys involved in that process to inform the assessment, and we're grateful for everyone who participated in that process. January through April of 2019, just around the corner, we're going to be working with both the advisory and steering committee to identify and define the health priority areas for the SHIP. And again, as I mentioned, by June 1st, we will have the final state health assessment in place and available for stakeholders to use. The SHIP work will focus on the data and input gathered from the state health assessment. The steering committee and advisory committee will meet throughout the summer and fall to deliver the SHIP no later than October 1st. So that will be in place in October of 2019. And as I mentioned earlier, partners, local health departments, hospitals are encouraged to align for their 2020 time frame for planning. In today's meeting, as Amy mentioned, you'll get an overview of the 2016 SHA and the 2017 to 2019 SHIP and what will be different this time around. You'll learn a little bit about the background of the 5 forums that we had this fall and a summary of those findings from the forums. I do want to mention that the 2019 SHA process is a little bit different from the 2016 SHA process, in that we saw this as a great opportunity to achieve some efficiencies. We will be conducting the state health assessment in alignment and in conjunction with 2 assessments that the Ohio Department of Health has to do also, the maternal and child health program and the maternal, infant, and early childhood home visiting program. Both of those assessments are also required as part of our grant requirements, so it made sense to collaborate and to work within this assessment. One of the reasons why is certainly, as many of you know, maternal and infant health is one of our current 3 SHIP priorities. And the timing works out for us this year. We do these other assessments every 5 years under federal rules, but the timing coincided, so we want to take advantage of the shared effort. The maternal and child health needs assessment is designed to identify needs for preventative and primary care services for pregnant women and infants, and that also looks at preventative and primary care for children, and also services for children with special healthcare needs. The McV program, I know many of you may be familiar with that. It's a collaborative partnership with federal, state, and local partners, and the goal is to improve family and child outcomes by implementing evidence-based home visiting services within Ohio's Help Me Grow program. So again, we're looking to achieve some economies of scale by combining with our state health assessment and state health improvement planning process. So I do want to conclude with a couple of thank yous. Thank you to the Health Policy Institute of Ohio for once again coordinating our efforts through the SHA and SHIP process. We very much appreciate your expertise. And I want to thank the ODH Bureau of Maternal and Child and Family Health for working with HPIO to align the MCH and McV needs assessments within the SHA process. I think it's going to be a good process and save on effort and cost. So, and I also finally want to thank everyone who is on the webinar and agreeing to serve on this committee. Finally, the State Health Improvement Plan, it's, again, I want to stress, it's not just a plan for the Ohio Department of Health or state agencies. We're really envisioning it as a plan that all stakeholders can align around and implement evidence-based strategies at the local level where they're meeting with Ohioans face-to-face and helping to improve their health. Thank you.
Thank you very much, Director Himes. Good morning, everyone. This is Amy Stevens at HPIO, the other Amy, and we are delighted to have so many people on the webinar today. I'm going to start with a refresher and some background on the current State Health Assessment and State Health Improvement Plan. As we saw on that poll at the beginning, we have a large number of folks on the webinar today who are new to the advisory committee. And that's really great, and we want to make sure that everybody's starting from the same place and you have the background information about the process last time around. As you may know, the 2016 SHA was released in August of 2016, and the 2017-2019 SHIP was released in February of 2017. And at the same time, ODH also released a guidance document to provide local health departments and hospitals with information on how to implement the SHIP at the local level. And all of these documents and supplemental materials are posted on both the HPIO website and also on the ODH website. So if you are new to this group, I encourage you to check those out, and I'll show you the web pages in a minute here. This is the vision and the mission for the SHA and the SHIP, and Director Himes went over this earlier in his remarks. And this vision and mission statement, these were developed with input from the advisory committee. last time around, and also with guidance from the Governor's Office of Health Transformation. The 2016 State Health Assessment really paints a picture of the health and well-being of Ohio. It's descriptive and was designed to inform the priorities in the State Health Improvement Plan. So for those of you who were involved in the prioritization we went through for development of the last SHIP, we really used the findings from the SHA to help inform the priorities and strategies that were in the SHIP. The State Health Improvement Plan is a different kind of document because it's really a plan for improving health. It's a menu of priorities, outcome objectives, and evidence-based strategies, and it was designed to be used by ODH and other state agencies at the state level, and then at the local level for use by local health departments, hospitals, and then all the different community partners that they work with. This is the framework for the 2017-2019 SHIP, and it identifies these three broad priority topics: mental health and addiction, chronic disease, and maternal and infant health. And then it has these 10 more specific outcomes underneath each of those categories, and that's where we get more specific and measurable to track our progress over time. And then equity is woven throughout this part of the framework by identifying priority populations for each of those outcomes. And those priority populations are the groups with the worst health outcomes that really need a greater focus. This is the second part of the SHIP framework. The SHIP really recognizes that we can't achieve progress on those 10 outcomes unless we're addressing all of these cross-cutting factors. And equity is woven in here as well by highlighting strategies in each of these buckets that are most likely to decrease disparities. This is from the ODH guidance for SHIP implementation, and it shows how local health departments and hospitals and other partners are to use the SHIP. And it's really, again, a menu approach that asks local communities to select at least 2 of the priority topics, and then to also select priority populations and strategies within each area. If you want to follow up and learn more about the SHA, the SHIP, and the related materials, I encourage you to check out either the HPIO page or the ODH page. And on the HPIO page, we are posting all of the materials for these advisory committee meetings, including the slides from today, and all future meetings will be sure to post the agendas and information there. You can also find the SHA and SHIP documents, the toolkits, the summaries, and then we also have materials posted there on the regional forums that we did in October. So if you were not able to attend one of the regional forums, you can pull up the slides from those forums, which include a presentation that we did on progress on SHIP outcomes from the previous SHIP. This is what it looks like on the ODH website. If you're navigating from the main HPIO page, it's under the Groups tab, where you can just put it into the search box. And this is what it looks like on the Ohio Department of Health website. And you may have noticed they've recently updated their website, and you can find the SHA SHIP information in the About Us section on the ODH website. So that was the information about the 2016 SHA and the 2017-2019 SHIP. Looking forward to the 2019 SHA, we'll be drawing on these sources of data along the top here. Today, we're going to focus on the online survey and the regional forums that we did this fall. And then at our next advisory committee meeting, we'll be talking more about the online SHA that will be a part of this 2019 SHA. I'm going to pause here for just a minute before we move on to talking more specifically about the regional forums and see if there are any questions for Director Himes or for the HPIO team. And we're going to take a minute here to see if anybody has typed in any questions.
All right, it looks like we do have a question, and that is it possible for the state to publish the next SHA in early 2022, by March, for example, so that everyone else can align with it?
Great question. This is Lance. The question concerns timing for the release of the 2022 State Health Improvement Plan. And certainly I understand the challenges that are presented by the quick turnaround. And I can't speak for that far in the future, but certainly we would endeavor to increase the timing on our end, so you've got more time on your end for planning and to adopt your CHIPs and your implementation strategies. It's a very good question and a valid concern, so we'll take that under consideration, and through the next planning process, I would certainly push to endeavor to have that done earlier on our end. So great question.
All right, we had another question, which was how do we envision using the advisory group? To review again, the role of the advisory group is to provide us with input on the SHA content and format. Now, there are some elements of the state health assessment that we are going to keep consistent with the last state health assessment. For example, Director Himes mentioned the mission and vision. We feel like that's a strong mission and vision and that there's no need to revisit that. For the most part, we anticipate the metrics that are in the state health assessment to remain the same, although we will have some conversation about that. We're also aligning with the MCH and McVie assessments, so there may be some changes relative to that alignment as well. So in addition to kind of advising on the content and format of the state health assessment, the advisory group will be assisting with the selection of the SHIP priorities. Once again, the three main areas, the three main outcomes that we ended up identifying in the last state health improvement plan, we don't envision a radical departure from those main three areas. And as you'll hear when we present the data from the regional forums, it sounded like, we had well over 500 people participating, and there was consensus that those three areas continue to need to be priority areas for focus here in Ohio. But we will be talking more about those and about the specific outcomes, as well as strategies. And that's really a key area where the advisory committee will come into play, because the evidence base is constantly evolving. And we want to make sure that we are selecting a menu of strategies and policies that are evidence-based, so that people working at the local level to align with the state plan have a good solid list from which to work and select in their efforts in their communities. And then lastly, the last element for the advisory committee to play a role is on dissemination and outreach. We realize that simply producing these assessments and plans is not enough. They have to get out throughout the state for people working in local health departments and hospitals, but also other organizations that are focused on mental health and addiction, people who are with community-based organizations, United Ways, to also review and hopefully align with as well. So we'll be spending additional time later in the process discussing dissemination and outreach.
We have another question here that says, if our trend has been to rank lower over time, what are other states doing different? Do we need to change our approach in the SHIP, and how do social and economic factors come into play? So I think this is referring to the America's Health rankings that Director Himes mentioned earlier. And this is definitely something that we took a look at and talked about in the current SHA-SHIP process, or the previous SHA-SHIP process. And in particular, we looked at the example of New York State, which is actually the state that has had the largest improvement in their America's Health ranking since 1990. They've really moved from having to being in the bottom to being towards the top. And one thing that they have done is to have a very strong state health improvement plan that functions very much like a menu, setting priorities and evidence-based strategies, and then offering guidance to local health departments and hospitals to select from that menu. So that was definitely a model that we looked at as we were developing the 2016 SHA and 2017-2019 State Health Improvement Plan. So that's one example of how we can look to other states for improvements.
It looks like that's all the questions we have for now, so I think we can continue with the meeting.
All right, thank you very much, Amy. Get back to our slides here. So my name's Haley Aka. I'm with the Health Policy Institute of Ohio as well, and I'm going to take us through the next portion of our meeting, introducing our SHA Regional Forum report. So as a first step in the SHA-SHIP process that we've just been over together, HPIO was contracted by the Ohio Department of Health to facilitate a series of 5 SHA Regional Forums throughout the month of October this year. And this is a similar process to the last SHA Regional Forums in 2016. Several of those forums were conducted in partnership with the Hospital Council of Northwest Ohio, and we're grateful for their hard work on that. We had broad participation from across the state in the regional forums, both geographic and by sector. We had a wide variety of sectors participate. This is the report that you see here on your screen that followed the forums. It will be posted soon, and so you'll have access to that. Amy Bush-Stevens will go over the results of this report, the key findings, here in a few minutes, but first we wanted to start with the purpose and some of the process for the SHA Regional Forums. The purpose of the regional forums was to gather information on these 4 topics. So first, we wanted to understand community strengths and challenges here in Ohio for the state overall and for the regions within the state. Second, we wanted to identify groups that are experiencing the worst health outcomes in the different regions of Ohio and the key disparities and inequities faced by those groups. Third, we gathered input on the priorities from the current SHIP and whether those are still being prioritized by communities across the state. So this includes the 3 priority topics, the 10 priority outcomes, and the cross-cutting factors from the 2017-2019 SHIP. Finally, we gathered feedback that will guide improvements to the next SHA and SHIP documents, and that includes the supplemental materials and the guidance provided by ODH as well. We gathered this information from these 3 sources. So we had facilitated group discussions at the regional forums. Forum participants also filled out worksheets that we then took back and analyzed the responses to. And then finally, we disseminated an online survey after the forums that went both to forum participants and to stakeholders who are unable to participate in the forums. Alongside the SHA Regional Forum process, we also conducted forums for the state's maternal and child health and maternal, infant, and early childhood home visiting assessments. You'll hear us refer to these as MCH and McV assessments. And as Director Himes mentioned, the next SHA and SHIP are being developed in conjunction with the MCH and McV assessments in order to sort of streamline state-level health planning in the next cycle. So HPIO has been contracted to conduct both the SHA SHIP and MCH McV assessments in the next year. So the regional forums occurred in conjunction with one another. The SHA regional forums occurred in a morning session, and the MCH McV occurred in the afternoon. There was also an MCH and McV online survey as well. And the findings from the maternal and child health activities are summarized in this separate report, which will be included as part of the final MCH McV assessment. A total of 521 stakeholders from across Ohio attended a regional forum. You can see the numbers here in parens of how many folks were at each of those events. These forums were held throughout the month of October and took place in the cities pictured here. Forum participants came from all over the state. We had 73 of Ohio's 88 counties represented by at least one participant at a forum. And a significant portion of these forum participants were represented by local health departments or hospitals. These are the main entities who are responsible for population health planning at the local level, but many other sectors were represented as well, including maternal and child health, behavioral health, education, and community-based organizations. During the forums, participants broke into small groups and were led through a series of questions by a facilitator. The first part of those discussions focused on community strengths and challenges. And so participants were broken out into small groups based on county so that facilitators could help identify the strengths and gaps of particular county types. So looking at the strengths and gaps for urban and suburban counties versus the strengths and gaps for Appalachian and rural counties. During the second half of discussion, facilitators were gathering feedback on the current SHA and the SHIP, so how those documents are being utilized at the local level and how they could be improved. And for those discussions, participants were encouraged to sit with representatives from a mix of counties. And as I mentioned previously, we also gathered feedback using an online survey in addition to those small group discussions at the regional forums. The online survey was shared with regional forum attendees as well as people who are unable to attend the forums. There were a total of 308 survey respondents, and we had at least one respondent from all 88 counties in Ohio, which is pretty wonderful. Here you can see how the breakdown was for survey respondents who attended a forum, which forums they were able to attend. We also found that almost half of the respondents to the survey represented local health departments, and then about 16% represented hospitals or hospital associations. Overall, we had 622 stakeholders participate by either attending a regional forum, responding to the online survey, or both. And this is about a 50% increase from 2016 when we had 404 stakeholders attend a forum or complete the online survey. And this brings us to our next poll question, which I'm going to throw up for us here. We'd love to know how you've participated in this process so far. Were you able to attend one of our regional forums? Did you maybe fill out the online survey, either for the SHA or for the MCH McV assessment? Maybe you did both. And perhaps you haven't participated yet, but you're looking forward to doing that in the future. So let us know how you've been able to participate, how you're looking forward to participating. We're looking forward to having you participate. I'll leave that open for just a few more seconds here. Great. All right, so it looks like we have some new folks on the call today, which is wonderful. And then also some people that were able to participate in the SHA Regional Forum and the online survey process, which is great too. We really appreciate that. All right, so now we're going to throw it back to Amy Bush-Stevens, who's going to walk us through some of the key findings of the report.
Thank you, Haley. I'm going to talk about the 3 key findings from these regional forums, as well as from the online survey. And I should mention first that this report summarizing the findings will be posted on our website within the next few days. So if you'd like to dig into the details a little bit more, you can access that report on our website soon. The first key finding is that the 2017-2019 SHIP health outcome priorities continue to be consistent with local community priorities, and that several cross-cutting factors also rise to the top as important to emphasize in the next SHIP. So these include things like poverty, transportation, physical activity, nutrition, and access to care. As a quick reminder, the 2017-2019 SHIP has these 3 broad priority topics and then 10 priority outcomes under that and several cross-cutting factors. And the online survey asked respondents to indicate whether or not these things align with their current local priorities in their county. Looking first at the 3 broad priority topics, you can see that most of the stakeholders said these are high or moderate priorities in their county currently. And mental health and addiction in particular was almost unanimous. The online survey also asked which of the cross-cutting factors from the SHIP most strongly aligned with local priorities, and these are the top 5 from a list of 9 factors. We also asked about equity on the survey, including a question about barriers to achieving optimal health for priority populations, and these were the top 5 barriers from a list of 13. The second key finding was that while each Ohio community is unique, there are many shared strengths and challenges and priorities across the state. During the regional forum small group discussions, stakeholders described many strengths and challenges that were unique to their community or their area of the state. So for example, urban and suburban participants talked a lot about ample resources and economic vitality as unique strengths, while in Appalachian and some of the rural non-Appalachian areas, folks talked more about positive cultural attitudes such as having friendly people and a focus on taking care of our own. In the Southwest region, which has been, of course, particularly hard hit by the opioid crisis, we heard a lot there about adverse childhood experiences, grandparents raising grandchildren, and strain on the foster care system. So those are just a few examples of some of the things that we heard that were unique or more emphasized in different parts of the state. Here's a look at community strengths by county type. The ones shaded in blue with a star are strengths that were unique to each county type, and then the ones in white are the ones that were common across all county types. So you can see there really were many shared strengths across the state. This brings us to the finding that there were, in fact, many shared strengths and concerns across the state. And one of the most striking findings was that transportation was a top 10 challenge for every region and for every county type. And this is an example of how we can align on shared priorities across the state while recognizing that the specific strategies to address those priorities will need to vary from community to community. So for example, at the forums, we heard stakeholders from suburban Franklin County and from rural counties like Vinton and Hocking talk about transportation challenges. But obviously the nature of those challenges is different in those different communities. And so in Franklin County, the focus might be on improving bus service to better connect low-income workers to jobs, whereas in rural counties, there may not be a bus system, and so it may be a different conversation about on-demand transit services or driver's licenses or things like that. This is another finding that really brought home the shared concerns across the state. These are the 3 broad SHIP priority topics from 2017 to 2019. And you can see that large majorities of stakeholders from every county type said these priorities align with their current local priorities. There's a little bit more variation when you look at the maternal and infant health priority area, and that may reflect differences in infant mortality rates in different counties across the state. The third key finding was that there are many opportunities to improve the next SHA and SHIP. We asked for feedback on the current SHA and SHIP in order to make improvements in the next editions. Overall, stakeholders reported that they felt the SHA, SHIP, and ODH guidance were effective at contributing to improvements in assessments and plans by local health departments and hospitals. But you can see that roughly a quarter of stakeholders said they weren't sure or that it was too soon to tell. And of course, local health departments and hospitals are at different points in the process at this point of doing their assessments and plans. And so SHIP alignment has not yet fully played out across the state. When we asked for suggestions for improvement on the survey and at the forums, the ideas generally fell into these 4 buckets. The most common suggestions were related to dissemination and outreach. And people talked a lot about the importance of making the SHA and SHIP concise and user-friendly and doing increased outreach and dissemination. They also called for additional help with SHIP implementation, including technical assistance, funding for SHIP strategies, and opportunities for peer-to-peer sharing and sharing success stories from local communities around the state. The executive summary for this report lists the 10 most frequently mentioned recommendations. So if you want to take a closer look at those, you can find them there. And all of these recommendations will be really important for us to keep in mind as we're updating the next SHA and SHIP. Now I'm going to take us to our next poll question, which is, what do you think is the most important thing to improve with the updated SHA and SHIP? And these are just a few ideas. So please take a moment to fill out the poll. Okay, we've got about 20% of you have filled out the poll. And I want to emphasize that these were some of the top suggestions that we heard about on the survey and in the forums. There's certainly other ideas to pursue as well. Okay, we've got 70%. Let's get a few more. All right, we're going to close it out here and take a look at the results. All right, so the biggest one was for more outreach to partners, including sectors beyond health, and then also more dissemination and higher visibility, and those two sort of go together. All right, great. Thank you for that feedback. And we're going to pause again to see if you have any questions on the material that Haley and I just covered. So any questions about the SHA regional forums?
We're pausing a second to see if there's any questions for Amy Bush-Stevens or Haley Aka, and not seeing any questions. So I think we can continue on.
All right, we'll keep rolling. So the next step in the process is continuing to work on the state health assessment. And we're going to learn more about that at the next advisory committee meeting, which will be in February. And we will get that specific date and time out to you soon. So we'll be learning more about the interactive state health assessment piece at that meeting. And before we end this meeting, we want to do a quick evaluation. So here's a recap of our objectives for this meeting. They were to make sure everyone was aware of the project timeline, understanding the purpose of the SHA SHIP and how it aligns with the MCH and McVie assessments that will be done at the same time, knowing where to find information on the SHA and SHIP, and being knowledgeable about the findings of the regional forums and the online survey. So we have one more poll question that we're going to pull up in just a minute here to see if we have met these objectives. So let us know if you agree that the objectives for this meeting were met. And if you did not agree, please send us your comments in the chat box. Or if you want to say something nice, you can too in the chat box. But in general, we'd love to get your feedback on how we can improve these advisory committee meetings and make sure that we're getting really good engagement from stakeholders throughout this process. And I should say that the next meeting of this group will likely be, again, a webinar meeting because it will be February, which can be a little dicey. And so we think that meeting will work well as a webinar, but there will also be some in-person meetings in Columbus. We want to have a mix of both in-person and online engagement so that we can include folks from around the state. All right, do we have the poll results? Oh, no, okay. All right, do we have a few more questions?
There is an additional question, and that was, how was the previous state health assessment and state health improvement plan disseminated? The Ohio Department of Health disseminated those documents through local health departments and hospitals throughout the state. I know there was a webinar conducted to share the document with those stakeholders, and of course it's been available on ODH's website as well, where it continues to be under the About Us tab, and then also those documents are on the HPIO website. I should say that while HPIO was not officially charged with dissemination, we have done a number of presentations where we have used, in particular, the State Health Improvement Plan, because we believe that that's a good, solid document that lays out what our primary priority topic should be for additional focus on our state, as well as outcomes and evidence-based strategies. Let's see, we have a couple of other, and I also see just a comment from the Ohio Commission on Minority Health that that they sent the SHA SHIP link to their listserv as well after the last process was completed. All right, well, I think that concludes today's webinar. Thank you Director Hines and Amy Bush-Stevens and Haley Aka for your presentations. We'll look forward to staying in contact with you over the next couple of months, and we'll let you know about the date for the next meeting shortly. Hope you all have a wonderful day.